Hi, we are group number 3, and today we are going to talk about the mental illness. What are mental illnesses? Mental illness refers to a wide range of health conditions that affect a person's thought, emotions, behavior, and ability to function in daily life. These disorders can vary in severity and duration, from mild and temporary to chronic and debilitating. Difference between mental health and mental illness. Mental health is a state of well-being in which a person can cope with everyday stress, work productively, and contribute to their community. Mental health does not mean the absence of problems, but the ability to manage them effectively. Mental illness occurs when mental health problems alter a person's thinking, mood, or behavior to the point of interfering with their ability to function. It often requires clinical intervention, such as therapy or medication. Main causes and risk factors. Mental illnesses arise from a combination of biological, psychological, and social factors. These elements often interact, increasing the risk of developing a mental disorder. Biological factors. Genetics. Family history of mental illness increase vulnerability. Brain chemistry. Imbalance in neurotransmitters such as serotonin or dopamine. Neurological problems. Brain injuries or developmental abnormalities. Physical health, chronic diseases, or hormonal change. Psychological factors, trauma, experiences of abuse, neglect, or significant loss. Person- Personality traits. Certain traits, such as low resilience or high sensitivity to stress, can increase risk. Cognitive patterns, persistent negative thinking or maladaptive coping mechanisms. Social factors, stressful life events, financial difficulties, job loss, or divorce. Social insulation, lack of supportive relationships or community. Cultural and socioeconomic influences, stigma, discrimination, and poverty can exacerbate mental health problems. Understanding this cause helps identify and treat mental health problems early, emphasizing the need for comprehensive care that addresses all contributing factors.
Hi guys, my name is Valvis. As you know, I'm going to talk about classification of mental illnesses. Mental illnesses disorders are a major challenge, a priority of modern public health, since they are among the most important causes of morbidity in primary care and cause considerable disability. Likewise, definition. They are clinical entities of long evolution, generally beginning in adolescence or early adulthood, with formation and recurrences that cause a great impact in the personal, family, social, and work functioning of the individual. Depressive disorder, also known as depression, is a common mental disorder. It involves a depressed mood or loss of pleasure or interest in activities for long periods of time. Depression can happen to anyone. People who have lived through abuse, severe losses, or other stressful events are more likely to develop depression. Women are more likely to have depression than men. Symptoms: poor concentration, feelings of excessive guilt or low self-worth, hopelessness about the future, thoughts about dying or suicide, disrupt sleep, changes in appetite or weight, feeling very tired or low in energy. Anxiety disorders. Everyone can feel anxious sometimes, but people with anxiety disorder often experience fear and worry that is both intense and excessive. These feelings are typically accompanied by physical tension and other behavioral and cognitive symptoms. Symptoms: trouble concentrating or making decisions, feeling irritable, tense, or restless, experiencing nausea or abdominal distress, having heart palpitations, sweating, trembling or shaking, trouble sleeping, having sense of impending danger, panic, or doom. Eating disorders. Eating disorders are serious health conditions that affect both physical and mental health. These conditions include problems in how you think about food, eating width and shape, and in your eating behaviors. Most common eating disorders: anorexia. Anorexia, also called anorexia nervosa, can be a life-threatening eating disorder if it includes an unhealthy low body weight, intense fear or gaining weight, and a view of weight and shape that is not realistic. Anorexia often involves using extreme efforts to control weight and shape, which often seriously interfere with health and daily life. Bulimia. Bulimia, also called bulimia nervosa, is a serious, sometimes life-threatening eating disorder. Bulimia includes episodes of being commonly followed by episodes of purging. Sometimes bulimia also includes severely limited eating for periods of time. This often leads to stronger urges to binge and the purge. Symptoms vary depending of the type of eating disorders. Anorexia and bulimia, binge eating disorders, are the most common eating disorders. People with eating disorders can have a different body types and size. Schizophrenia is a serious mental health condition that affects how people think, feel, and behave. It may result in a mix of hallucinations, delusions, and disorganized thinking and behavior. Hallucination involve seeing things or hearing voices that aren't observed by others. Delusion involve firm beliefs about things that are not true. People with schizophrenia can seem to lose touch with reality, which can make daily living very hard. People with schizophrenia need lifelong treatment. This includes medicine, talk therapy, and help in learning how to manage daily life activities. Symptoms: delusions, hallucinations, disorganized speech and thinking, extremely disorganized or unusual motor behavior. Thanks.
Good morning, classmate and teacher. My name is Cesar de los Santos, and today I will talk about common symptoms associated with mental illness. Signs and symptoms of mental illness can vary depending on the disorder, circumstances, and other factors. Symptoms of mental illness can affect emotions, thoughts, and behaviors. Some examples of signs and symptoms include of sadness or discouragement, confused thoughts or reduced ability to concentrate, excessive worry or fear or intense feelings of guilt, ups and downs and radical mood swings, withdrawal from friends and activities, severe fatigue, low energy, and sleep problems, disconnection from reality, delusions, paranoia, or hallucinations, inability to cope with problems or stresses of daily life, problems understanding and relating to situations and people, problems with alcohol or drug use, significant changes in eating habit, changes in sexual desire, excessive anger, hostility, or violence, suicidal thoughts. Sometimes symptoms of a mental health disorder appear as physical problems, such as stomach pain, back pain, headaches, or other unexplained aches and pains. Diagnostic methods. Diagnosing mental illness is a complex process that requires a comprehensive, multidisciplinary assessment. Number one, clinical assessment. Clinical interview. Mental health professionals conduct detailed interviews to understand the patient's symptoms, medical history, and context. Behavioral observation. Assessment of the patient's behavior in different situations. Number two, psychological test, questionnaires and scales, standardized tools such as the Beck Depression Inventory (BDI) or the Hamilton Anxiety Rating Scale (HAM-A) to measure the severity of symptoms. Neuropsychological test, assessment that measure cognitive functions such as memory, attention, and reasoning. Importance of early diagnosis. Early detection of mental disorders refers to the process of identifying the symptoms of a disorder in its early stages. The earlier a problem is recognized, the greater the chance of effective treatment and full recovery. Studies have shown that early intervention can significantly reduce the duration and severity of episodes of mental illness. For example, in the case of people suffering from depression or anxiety, early treatment can prevent them from progressing to more severe disorders, which in turn can decrease the need for more invasive treatments such as hospitalization.
Diagnosis and evaluation. Blind mental health professional choose psychology as a chosen to a clinic collision questionnaire. En specificar en usar en disorder en saler esquizofrenia vacule disorder. Common trimmer, psychological, therapy connect, tepihil, CBT affected, the preparation and salary and that is disorder. Hospitalization may be necessary in cases of case, crisis, such as suicide risk, psychiatric qu'episode events you make. Chances and electromagnetic therapy on transmission, magnetic stimulation, in cases where other treatment do not work. Real probation continued. Treatment plan, Dr. Down. Trend recommendation, even if system is prone. Recognition warning identified system to sit young in time. Maintaining a stamper. Some people might never read session, test parent, relaxer, interchange in serving causes. Community support, symbol family and community in treatments.